What if one injection every 2 weeks could lower your bad cholesterol by 60%, even when statins aren't enough? Your LDL cholesterol is 80 to 180, for example, despite taking medication. The question is, are you out of options? The answer may surprise you. Heart attacks often strike without warning. Today I'll show you one of the biggest breakthrough in cholesterol treatment in past decade. Hello everybody, I'm Dr. PK, practicing in California for the last 30 years. Today we are talking about one of the most exciting advances in cardiovascular medicine, PCSK9 inhibitors, commonly known as from the brand name Repatha Praluent injection. These medications are helping thousands of patients dramatically reduce their cholesterol levels and lower their risk of heart attack and a stroke. But are they right for everybody? Let's find out. So, some basic stuff. What is cholesterol? Before understanding PCSK9 inhibitors, let's quickly review cholesterol. Your body needs cholesterol to make hormones, build cells, produce vitamin D, but too much of LDL can become dangerous. LDL is often called the bad cholesterol. LDL particles enter arterial wall. Over time, they form foam cells and then plaque. Eventually, these plaques can rupture. They can cause heart attack, a stroke, peripheral vascular disease. So, what is PCSK9? Now, this is where science gets really interesting. Your liver removes LDL cholesterol from your blood using LDL receptors. Think of the receptors as tiny vacuum cleaners. The more LDL receptors you have, the more cholesterol your liver removes. But your body also produces a protein called PCSK9. And this protein destroys LDL receptors. That means less receptors, meaning high cholesterol. How do PCSK9 inhibitors work? PCSK9 inhibitors block this destructive protein. As a result, LDL receptors survive longer. More LDL is removed from blood. Cholesterol drops dramatically. It's actually one of the most effective cholesterol lowering treatment available today. I'll give you a simple analogy. Imagine your liver has 100 garbage trucks and PCSK9 destroyed 50 of them. Only 50 trucks remain to collect cholesterol. Now imagine you block PCSK9. Suddenly all 100 trucks are working again. Result, much cleaner blood vessels. How much can they lower LDL? Clinical trials have shown statins alone, LDL reduction is about 30 to 55%. If you add PCSK9 inhibitor, additional 50 to 60% LDL reduction is possible. Many patients achieve LDL levels below 70 or 55, even below 30 milligram in selected high-risk patients. These very low LDL levels have generally been shown to be safe in major clinical trials. The question is, who should take them? These drugs are not first-line therapy. Doctors usually prescribe them in patients who have previous heart attack, especially if cholesterol remains high despite treatment. Number 2, previous stroke from atherosclerosis. Number 3, coronary artery disease, patient with a stent, patient with bypass surgery or severe plaquing. Number 4, familial hypercholesterolemia. This is an inherited condition. Even healthy young adults may have LDL of 220, 250, 300. In fact, I have one patient whose LDL is 450. And diets alone won't solve it. And number 5, the statin intolerance. Some people develop severe muscle pain. They can't handle statin, or liver problems, or true statin intolerance. PCSK9 inhibitors become an excellent option. Number 6, very high risk diabetes patient, especially those with established cardiovascular disease. So how are they given? Unlike the statin, these medications are injection. People inject them every 2 weeks, or sometimes even once a month, depending on medication and dose. The needle is tiny. Most patients say it hurts less than checking blood sugar. Injection takes less than 1 minute. And duration, well, that depends on the situation. High cholesterol usually returns once treatment stops. So this medication is generally intended as a long-term therapy for patients who continue to meet those criteria. Side effects are very well tolerated. Common side effects, mild injection site reactions like redness, swelling, itching. Cold-like symptoms can happen, runny nose, sore throat. Some people may have muscle ache, but extremely uncommon. Some rare situation, difficulty breathing, facial swelling, etc. Do they affect liver? No, they don't affect liver. Routine liver monitoring is generally not required as we do with the statin. Do they cause diabetes? No. Current evidence has not shown a clinically significant increase in diabetes risk with PCSK9 inhibitors. Now, very important question, and I'm sure you're wondering about it. Can they reverse plaque? This is exciting. Imaging studies have demonstrated that intensive LDL lowering, including with PCSK9 inhibitors added to statin, can slow plaque progression, even produce modest plaque regression in some patients. This means arteries may become healthier over time. So latest research I'm going to talk about. Several landmark clinical trials changed cardiology practice. The 4-year trial, the patient taking evolocumab experienced lower LDL cholesterol, fewer heart attack, fewer strokes, fewer coronary revascularization procedures. Then there was Odyssey outcomes trial, where alirocumab reduced recurrent cardiovascular events in patients after a recent acute coronary syndrome, particularly in those with highest risk. Current guidelines, recent cholesterol guidelines recommend considering PCSK9 inhibitors for very high-risk patients with established cardiovascular disease whose LDL remains above goal despite maximally tolerated statin therapy when appropriate, ezetimibe. Adults with familial hypercholesterolemia who do not reach LDL targets. The medication are expensive. In America, they cost $14,000 per year. The prices have dropped substantially. Many insurance they pay to cover them for patients who meet those medical necessity criteria. Although most of the time, prior authorization is required. We should not take them. This medication may not be appropriate for people with known serious allergy or who do not meet evidence-based treatment criteria, or individuals with isolated, mildly elevated cholesterol that can be controlled with lifestyle changes or a statin alone. Lifestyle still matters. Even if you're taking PCSK9 inhibitor, we still need to eat healthy, heart-healthy diet, exercise daily, stop smoking, and maintain a healthy weight, increase soluble fiber, eat omega-3 rich food. Lifestyle and medication, they work together for the best cardiovascular protection. And a heart-healthy eating pattern remains the foundation of treatment. So PCSK9 inhibitors represent one of the greatest breakthrough in cholesterol management. They lower LDL by around 60%, reduce heart attack, reduce stroke, help patients who cannot reach cholesterol goals with a statin alone. So if you have had a heart attack, a stroke, or familial high cholesterol, or persistently elevated high LDL despite treatment, ask your healthcare provider whether a PCSK9 inhibitor could be appropriate for you. So like the video, subscribe for more evidence-based medical education. I'm Dr. PK. Stay healthy, stay informed, and I'll see you in the next video.